Do you struggle with headaches that just won't go away? What if I told you that your neck might be the real cause? Research shows up to 15 to 20% of all headaches are cervicogenic, meaning they start in the neck but are felt in the head. In this video, I'll show and explain how neck problems trigger headaches, what most doctors miss, and to share quick few fixes you can start today, including one breakthrough treatment we're using in our clinic that's helping even with the toughest cases. Cervicogenic headaches are headaches caused by dysfunction or lack of mobility in the cervical spine, especially in the upper cervical joints. We have seen headaches come from the lack of mobility in the upper neck to the first rib lack of mobility. Studies show that reduced mobility in the upper cervical spine and muscle tightness can restrict blood flow and irritate the nerves, leading to referred pain into the head. Typically, medical treatments often focus on the symptoms, such as medication and injections, rather than the underlying neck dysfunction. How the neck triggers the headaches. So there's really 4 areas that will trigger headaches that are coming from the neck. And the first thing is, we always say mobility before stability. Mobility before even doing like soft tissue work, because if the mobility is not there, then the tissue will tense up and protect. And that's what happens in the upper cervical spine, which is up here close to where the skull is. If you are not moving very well up and through here, that lack of mobility will create that muscle tightness, and that muscle tightness will then limit blood flow and pinch on nerves, creating pain that wraps around into the head like this. And so you can also get it triggering a lot of weird head symptoms. You can get it triggering a lot of eye stuff, nose stuff, ear stuff. Like you've heard me talk about some of these things. It all can happen from the upper cervical spine, and it starts with mobility. We always have to look at mobility first. Then other areas that will also create headaches will be posture. The posture, if we don't fix those posture things, so for like forward head posture, when we go forward head like this and our head's forward like this, what ends up happening is in through here, you're taking that neck to end range. And when you take it to end range, it's having to hold that position at end range, which also will create some of that tightness that then creates that joint stiffness. So it all relates together, but sometimes when you don't have joint stiffness, it's just posture related stuff that's creating some of the tightness. You've got to fix the posture. Another big one that we see all the time from a posture is they'll have multiple screens. So they'll have a screen here when they're typing and doing stuff, but then they'll have a screen, they'll have 2 screens, one off to the side. So they'll be looking to the side, looking like this, and this is how they are for hours and hours, every single day that they're doing this. And that creates a lot of, so if you're like this, then you're going to get that rotation and you're going to get stuck in that area that all of a sudden you're not going to be able to move very well because you've just created this pathway where you're always moving that way. We see stuff like that all the time where they need to stack the computers like this. So they're looking at them straight forward, and they don't have a lot of head tilt up or head tilt down. They're just kind of like in a good position where you can kind of look up with your eyes and see the top screen, and then you can definitely see the one in the middle as well. So posture is a huge component to this that is often missed, that we always are asking. Once we do our evaluation, I almost can tell people, I'm like, your computer screen's over here, isn't it? She goes, yeah, how did you know? Because I can tell you're not moving. You're so stuck. That's what happened. So another thing that people never look at that can trigger headaches is the upper thoracic spine. So that first rib mobility, it actually refers to the base of the skull, because muscles that come down through here also attach up and through here. And so if you're not moving through here, you're getting protection that pulls down on the skull and creates the headache. So not always does it come from the thoracic spine, but it's definitely a component that we look at, because when we get their neck and we're moving their neck and they're like moving great and they're getting headaches, I'm like, that's really weird. You go down into the ribs and they're like, oh my God, that's reproducing my headache. Yep, there it is. When we get this moving, your headaches will go away. And so again, mobility before stability, before doing soft tissue, you get that joint moving, and then whatever's left from that shortening, then you can release it. The last thing is chronic shortening of the tissue that's just been chronically like shortened. when you have tissue like that, that's been like that for a while, and it could have started because you didn't have good mobility in the neck, and now that we get the good mobility in the neck, you're still having problems, and that tissue is still part of that problem. When you get that chronic shortening, it gets shortened and tight, you end up having a lack of blood flow in those areas. And even if you try to massage it out and manually work it, it doesn't fully resolve. It gets better, but it comes right back again because it's literally like scarred down. It's stuck tissue. And so we'll talk about a treatment that we do in our office that like knocks that out immediately, that's giving people their lives back. And so when you get that stuck tight tissue, again, you restrict the blood flow in those areas, you compress on nerves. And so if you can get those to release, then all of that will feel better, and then your headaches will go away. So what are some of the things symptom-wise that point to the neck? One of them is if you're getting pain at the base of the skull, like right in through here, you're getting headaches, more than likely there's stuff that's coming from the neck. If you also get pain in your neck, pain and stiffness in your neck, and you're getting headaches, also probably common to have a neck issue. If you're getting pain even in through here and you're having headaches, this is also triggering that. And so those are all different symptoms that you have. The last one is if your posture, and you won't know this, but like, let's say you work during the week and you get horrible headaches by the end of the day, but on the weekends you actually feel pretty good. It's your posture of what you're doing throughout the day that's creating those headaches. So it's like when the headaches come on, like when does it come on? What are you doing? And we start piecing some of those things together and go, oh, this is what it is, and we can start making those adjustments. So what are some quick fixes? Some quick fixes that you can do. So the first one, we're going to show you a couple of exercises that you could do that are going to be that are going to help, but getting to a PT that can evaluate you is going to be key, because they can start looking at, like, sometimes it's not even tightness up here, you have tightness here and here and here, down into the, like, it can be all the way down. We've got to get all that opened up. And so us looking at like where things are and where you're tight, we can give you specific exercises based on what we find in that evaluation. But the ones I'm going to show you today are some really common ones. The first one I'll show you will be for that first rib, because that's a common one, and then I'll show you one on the table. So when you use this, you're going to put this on the top. So it's like a really meaty part on the top. You'll feel like, oh yeah, I just need to get this massaged out, but you massage it and it comes right back again, or it makes you feel worse. Sometimes it makes the headaches feel worse. The reason why it can make you feel worse is you're releasing the protection, and now like what you didn't resolve is now like showing its angry head and says, oh my God, this, like, I'm protecting it for a reason. So you take away the protection, you're going to hurt more. So a lot of times when you get massages for things like this, they actually make you feel worse. We're actually doing a rib mobilization with it. So you're literally going to put this on the top part of your shoulder here, and you're going to pull down. So I'm pressing this straight down. You may have to kind of hold it. If you hold it, you're going to hold it with the opposite hand to kind of keep it there, and then you pull down. Sometimes I can even pull down and bring my head like this, and you'll feel it go all the way up into the skull if you're having headaches. So if you push down and just kind of tilt your head, you're giving yourself kind of a myofascial release, but you're also mobilizing that rib. So you're kind of doing two things at once. And so you just kind of press down. This will be like, it hurts, but it feels good at the same time. Like you feel like you're pushing the pain out of your body. As you do this more, you'll notice that like it gets to be like it's no big deal at all. Ever so often, you'll have stuff in the second rib and through here. So if you want to hit that, you can also do this where you'll find the spot. And when you find it, you literally just pull, like you'll find like that's a rib right there. And you're going to pull this direction. So you can pull and mobilize, like you're mobilizing that rib. And again, it's going to be like oh, that hurts and feels good at the same time. When you get this moving, the tissue around it will start melting. A lot of times when we start mobilizing people's joints, we're like, oh, this massage feels amazing. I'm like, we're actually not massaging you. We're actually mobilizing you. But we're going through the tissue that's tight, that's protecting, so you feel like it's a massage, but we're really mobilizing those ribs. So that's two ways that you can use this to start getting the thoracic spine. If you're feeling pain in through here and you're getting headaches, this is more than likely the thing that you want to do. If you only have pain up in here, there's a couple of things we could do. I usually start out where I'm stretching both sides, and if that feels like it's making you worse, then you're going to go to doing this other stretch that I'm going to show you, where if it's on the one side, that's the stretch that we'll do. But you'll start out this way. You'll be on your stomach. And what we're going to do is you're going to have your hands in front of you, and you're going to look at your hands. So your head is in a good position. I've shown this exercise before. You're going to retract it, and you're going to hold it. And you're going to breathe. And you're just focusing on getting the stretch up and through here, and we're just stretching the joint. So like when we retract, we're actually flexing the upper cervical spine. It's moving forward. So we're moving this back, and the head's kind of moving forward with gravity. And you'll feel the stretch up in here. And what you're going to want to do is you're going to want to hold that for like a minute or two, doing it a couple times throughout the day to really get a good stretch. If you're feeling like, that does not, like I don't feel like it's helping, or it's making it a little bit worse, we may have to do this next stretch, which will stretch on the one side. So if you notice that your pain is on one side, so like let's say it's over here on this left side, and I'm getting some pain, you're going to want to stretch it this way. What you'll do, if you notice that that one other exercise doesn't work, is you're going to lie on your back, and you're going to pull your head away from the side that's tight. So that's my left side. Let's say it's tight. You're going to literally go ear to shoulder, so no rotation here. Then you're going to hold it, and you're going to rotate the opposite way. And again, breathe. And that's going to stretch the upper cervical spine and the upper part of that neck on that one side. So if the first exercise doesn't work, go to the second exercise. If that's not fully resolving it, man, I'm telling you, get into someone like our office where we can help you figure out exactly where you're tight to be more specific. The manual work is amazing. And the thing that's actually helping our office the most when we have these really tricky headaches that haven't, but like they've gotten better, but we haven't fully resolved them because they're so chronic, is Shockwave. Shockwave will knock out that muscle tightness that has been there for a long time because it has a lack of blood supply, lack of blood flow in those areas because it's been so tight for so long, or it's just kind of scarred down a little bit because it's been like that for so long that Shockwave will shockwave it all in the upper part of the cervical spine up and through here. It will knock it out really fast. Now, usually it'll take about 2 to 3 times before you start noticing like, whoa, man, I'm having some really good days, and it feels amazing. So it does take about 2 to 3 visits to notice a big difference. But once when you do, like game over, you're feeling amazing. We've had clients that have been in pain for 10 years and nothing has worked, and they've tried everything. You talk about everything that you try for, Botox injections, burning the nerves, doing medications, cortisone injections, like all these things, and nothing has worked. It's because they're missing a piece of it. Like they're treating a symptom. We've got to get down to the root cause, and that's what our evaluation process does. So you've been chasing treatments for your headaches and nothing has worked. Don't overlook your neck. It could be the missing piece. Try some posture and mobility fixes I showed you today. And if you want to explore more advanced solutions like regenerative Shockwave, reach out to our specialist who understands how these issues are connected. If this video was helpful, hit the like button and subscribe for weekly tips on pain relief and mobility, and share this with someone who struggles with chronic headaches. And if you want to learn more about how the neck connects to other symptoms like vertigo, ear issues, vision changes, click right here for my next video, and I'll see you there.